Hi, my name is Jessie Venning and this is the second part of my anatomy assignment. My student ID is VEN130000381. So, what is the function of the skeleton? The function of the skeleton is support. The skeleton gives shape, size, support. Without a skeleton, we wouldn't be able to meet the demands of everyday life and activities. There are three main different body types. The first one being ectomorph. They are typically tall and thin with narrow shoulders, hips and chest. An endomorph is rounded appearance with wide hips and narrow shoulders. Mesomorph, muscular physique with wide shoulders and narrow hips. Without a structure, we wouldn't be the way we are and we would just be a pile of bones. Protection. Bones of the skeleton protect the vital organs inside us. Without the protection, our vital organs like the heart, lungs, brain would be easily damaged. For example, the ribs protect the heart and lungs, the cranium protects the brain, and the vertebrae protects the spinal cord. Muscle attachment. Muscles attach to the long bones. They attach via tendons, and they pull on the bones so the muscles act as levers for movements. Blood production. Blood production and bone marrow. Bone marrow is contained in certain bones and produces red and white blood cells. If people have a bone marrow transplant, this is because they are not producing enough red and white blood cells. The role of the white blood cells are to fight infections and diseases. Mineral storages. Bones act as mineral storage. Bones act as storage for minerals such as phosphate and calcium. Calcium is the most commonly known as it helps bones grow and strengthen your bones. A lack of these minerals can affect your bones by becoming weaker. The axial and appendicular skeleton. In total, there are 206 bones in the skeleton. The red bones here are the axial, and they are made up of the ribs, cranium, sternum, and they are mainly used for protection to protect the vital organs, so the brain, heart, lungs, and there are 80 bones. The appendicular are all the bones in blue, and they are used for movement, limbs, attachment, so arms and legs, which then are attached onto the axial skeleton. Types of joints. There are three main types of joints. They are fibrosus, cartilaginous, and the synovial. The fibrosus is known as the immovable. They are very stable, for example the cranium. This is good because you do not want the cranium to move, because if it did move you could potentially damage your brain. Cartilaginous. They are known as a slightly movable joint, and they make very slight movements. Bones are connected by cartilage, so they are very stable, for example the vertebral column. The synovial joint. They are freely movable and move in any direction within a certain extent without injury, for example the patella. There are six types of synovial joints. The first one is the pivot. This is the type of movement that it can do is rotation. An example would be the vertebral column. The hinge joint type of movement that can do is flexion and extension, and an example would be the elbow and the knee. The condyloid joint, range of movement it can do is flexion, extension, abduction, adduction and circumduction, and the example would be the wrist. So you can twist it round, bend it forward, side to side, you can do a lot of movements. The ball and socket, type of movement it can do is flexion, extension, abduction, adduction, and the example would be the shoulder. So the same as the wrist, you can move it round, there is a wide range of movement that you can do. And the saddle joint, the range of movement it can do is flexion, extension, abduction, adduction, and circumduction. An example would be the thumb. The gliding joint would be flexion, extension, lateral extension, and rotation. An example would be your carpals. The types of bones. There are 5 types of bones. You have the long bone, the short bone, the irregular bone, the sesamoid, and the flat bone. The long bones, such as the femur, humerus, and the tibia, they are classed as long bones because they are longer in length than they are width, and they have growth plates at the end of the bones. Short bones, for example the carpals and the pisiform and the phalanges, are as long as they are wide, and they provide support and stability for small intricate movements, so like holding a pen, tying a shoelace. The irregular bone, it can, for example, be the vertebra and the mandible, which are known as the jaw, that provides protection, and they're most likely to be complex shapes. The sesamoid bone, for example the patella, or is also known as the kneecap, is embedded in the tendon, and it is given the name because it's like a sesame seed. The flat bone, known as the scapula, or a flat bone like the scapula, also known as the shoulder blade. They're flat plates for protection, they're thin for protection, and so muscles can attach onto them. There is 3 types of muscles. There is involuntary, voluntary, and cardiac. Involuntary are known as smooth muscles, and they work all day every day without your body even trying to do it. So for example, your heart beating is involuntary. Voluntary, we choose to use these. So for example, running, you choose to do it, so your muscles are contracting when you run, and they're frequently used when during exercise. And cardiac muscles are a type of involuntary muscles, for example the heart, but this can also be known as the pacemaker. Thank you for watching.